A new health scare is sending shockwaves across the globe. Human metapneumovirus, or HMPV, is on the rise in China. Hospitals are overflowing, videos of overcrowded emergency rooms are going viral, and there are several unconfirmed claims that countries' crematoriums are struggling to keep up with the demand. But should India be concerned? Is this the beginning of the next pandemic after the COVID-19 pandemic? Or are we just witnessing another seasonal surge in respiratory illnesses? Hello and welcome. You're watching Statecraft with me, Geeta Mohan. In recent days, news agencies, news portals, and websites have been flooded with speculation, and social media is ablaze with reports of rising cases of HMPV causing panic. The parallels to the early days of COVID-19 pandemic are hard to ignore. But let's separate fact from fiction. HMPV has been around for years, and while it is now spiking in China, it hasn't yet spread globally. So could this be the next pandemic in the waiting? Or is it simply the winter flu season playing out on a larger stage? As China grapples with this alarming surge, the world is watching closely. The big question on everyone's mind: should India start preparing for the worst, or is this just another blip on the radar of seasonal respiratory illnesses? Stay tuned as we break down the facts and separate the hysteria from reality. Human metapneumovirus, or HMPV as it is known, a respiratory virus often likened to the flu, is causing waves of concern across China. The symptoms, fever, cough, runny nose, and wheezing, might seem familiar. But in vulnerable groups, particularly children and the elderly, this virus can escalate into more severe respiratory conditions like bronchitis and pneumonia. Alarm bells are ringing in China's medical community, which is already under strain due to simultaneous spikes in influenza A and mycoplasma pneumonia cases. Videos circulating online depict packed hospitals and overwhelmed healthcare workers, with some reports even suggesting crematoriums are struggling to keep up with rising fatalities. However, these claims remain unverified. What is clear is that the surge of respiratory illnesses is stretching China's healthcare infrastructure to its limits once again, igniting concerns both domestically and internationally. Experts are pointing to several contributing factors behind this alarming rise. Seasonal trends play a significant role, as colder winter months create ideal conditions for respiratory viruses to thrive. Another factor is what epidemiologists are calling the catch-up effect. After years of stringent COVID-19 lockdowns and reduced social interactions, many individuals, particularly children, are now being re-exposed to pathogens they haven't encountered before. This lack of exposure has left some populations more susceptible to respiratory infections because of lower immunity. Experts are pointing to several factors behind the surge: colder winter weather, the catch-up effect following COVID-19 lockdowns, and the massive strain on healthcare systems. But is this just a seasonal spike or something more serious? As panic grows, let's take a closer look. While reports from China are concerning, World Health Organization has not declared an emergency, and no widespread global transmission of HMPV has been confirmed. But remember, even during the COVID-19 pandemic, WHO took a very long time to declare it one.
And the reason that's happening is it seems to be, the peak seems to be happening much sooner than we would ordinarily expect. You usually don't see it in the fall, usually as we get closer to the winter, but it's happening earlier this year, possibly because kids have not been in contact with one another for a couple of years because of social distancing or masks, and now they're getting exposed either oftentimes from their siblings who are school age. And again, among older individuals, it can cause pneumonia, and it's very hard to distinguish that from influenza or COVID-19. First of all, this is a virus that's transmitted most likely by droplet contact. similar to influenza, rather than a true airborne respiratory virus, rather than a true airborne virus like COVID-19, through droplet contact, people who sneeze or cough, and the droplets are on the surface, and then you pick it up from your fingers and you introduce it into the mucous membranes of your nose or mouth. So hand washing is really important, and wiping down surfaces, I think, would help as well. And wearing a mask, could be extremely. This is an example where wearing a mask could be extremely helpful. I think the other thing to think about, though, is with 3 different viruses circulating, one of the reasons why you might be seeing more hospitalizations is kids or adults are getting co-infections, some combination of RSV with COVID, with influenza, and by the way, other respiratory viruses. So if you can take 1 or 2 of them off the table by getting vaccinated, that's a big help.
It's a message of caution, not fear. While India has learned valuable lessons from the COVID-19 pandemic and the country's health infrastructure has improved, there are steps we must take to stay prepared. Here's a breakdown of what we know. The HMPV outbreak in China is currently contained within the country, but it has put the healthcare system under tremendous strain. Also remember that this is end of the year and the Chinese New Year celebrations ended. There are many travelers who went from China to various other countries, and many Chinese nationals who travel from various other countries for holidays back to China. So the impact of this virus could be felt or may be felt a little later. Doctors are concerned about the overcrowding of hospitals and the mounting number of cases. Social media posts have amplified the panic, with some claiming hospitals and crematoriums are overwhelmed, although there's no official confirmation of these claims. Still, the rise of respiratory illnesses in China has made global health experts nervous. The most vulnerable populations include the elderly and young children, and they are at particular risk. With winter in full swing, respiratory viruses tend to spread faster, creating an additional layer of concern. With no official pandemic declaration yet, should India take proactive measures? The country's government has yet to issue any alerts. However, Indian healthcare officials recommend that India enhance surveillance systems, educate the public on the symptoms of HMPV, and ensure that healthcare facilities are prepared for potential rise in cases. The virus spreads mainly through respiratory droplets, which means close contact and contaminated surfaces are key factors in its transmission, as was the case during the COVID-19 pandemic. Experts emphasize the importance of basic hygiene. Wash hands frequently, avoid close contact with sick individuals, and sanitize surfaces. India, with its large population and dense urban centers, remains vigilant, especially as it experiences its own winter season when respiratory illnesses like HMPV tend to peak. But what if the outbreak escalates? Should India start taking more drastic measures? The fear of another pandemic is indeed real, and many are still haunted by the effects of the COVID-19 pandemic. However, authorities remain cautious. Currently, India's health authorities are on alert but have emphasized that there is no immediate cause for panic. The country's vast experience in handling outbreaks, from COVID-19 to seasonal flu, has prepared it to respond quickly to new health threats. But as the world learned in 2020, vigilance is key. Experts are calling for more research into the transmission dynamics of HMPV to understand how it spreads and how to mitigate risks. Proactive measures are the need of the hour. Raising public awareness about human metapneumovirus, that is HMPV, and equipping healthcare systems to handle surges in respiratory illnesses are essential first steps. Strengthening surveillance networks, educating citizens on prevention, and ensuring medical facilities are prepared can help mitigate risks. As India monitors the unfolding situation in China, it is important to separate fact from fear. While the outbreak deserves attention, there is no evidence to suggest it signals the onset of another global health crisis. HMPV, though concerning for the vulnerable population, has not shown the kind of rapid transmission that characterized COVID-19. Experts urge calm, pointing out that seasonal factors and post-pandemic immune vulnerability likely explain much of China's current surge. For India, the lessons of the past offer a robust framework for preparedness. Focused interventions from hygiene campaigns to readiness in hospitals can ensure that any potential threat is swiftly addressed. Headlines may be alarming, but perspective matters. Vigilance without panic is key. India's proactive stance, coupled with public cooperation, can ensure that this healthcare scare remains just that, a scare, not a catastrophe. The country's preparedness will be a decisive factor in safeguarding public health. But this doesn't mean India should lower its guard. With continuous monitoring and the right preventive measures, India can stay ahead of potential outbreaks. Experts say that while this virus is concerning, it does not yet appear to be a global threat. So as we await more data from China and international health organizations, India must remain vigilant without succumbing to panic. Public health efforts should focus on education, surveillance, and preparedness rather than fear. Thank you for watching Statecraft. Goodbye and take care.